action.
Hi there, welcome to OTTV, where it's always sunny in grad school.
You're watching Radical Red News with 5-time Emmy Award-winning anchors Mike and Mike.
We're here today to tell you about ethics. The value system of occupational therapists is outlined in the AOTA Code of Ethics. This code aims to promote and maintain high standards of practice for the OT profession.
Identified within the code are 7 core values and attitudes that serve as a foundation to guide OT professionals in their interactions with others and must be understood so that the most ethical course of action can be taken.
These core values are beneficence,
Non-maleficence,
autonomy and confidentiality,
duty,
procedural justice,
veracity,
and fidelity. Beneficence includes all forms of action intended to benefit other people, including acts of mercy, kindness, and charity. Beneficence takes place when an OT promotes good and prevents and removes harms through their action.
Non-maleficence is the obligation of the OT to not impose the risks of harm, even if the potential risk is unintentional.
Boy, that one's sure important, isn't it, Mike?
Yeah, never know when that can happen.
Yeah. Autonomy and confidentiality involves an OT's professional duty to treat according to the client's desires, within the bounds of the accepted standards of care, and to protect the client's confidential information.
So, what is that?
You know, I think that means don't share their information.
Oh, good enough.
I know.
Okay, I got it now. Duty should achieve and continually maintain high standards of competency.
That duty is very important.
It's way up there.
Procedural justice means that OT professionals should treat clients in a fair, equitable, and appropriate manner, and with respect to the applicable laws and standards within their scope of practice.
Veracity includes the transfer of comprehensive, accurate, and objective information when representing our profession, and also fostering an understanding of such information for others.
Fidelity means to treat colleagues and other professionals with respect, fairness, discretion, and integrity.
Hey, I think we got fidelity down well.
I think we have it down great, Mike. Watch the following video and see if you can identify the ethical dilemmas.
Hi, Mike. I'm Dr. Actrick, but you can call me Jerry. It's
Hi,
very
Jerry.
nice to meet
Nice
you.
to meet you, too.
Have you ever been to occupational therapy before?
I have.
Okay, great. Well, we're going to do some activities here on the mat table, so I'm just going to transfer you over there.
Okay.
Okay, you ready?
Sure.
On the count of 3, we're
All
just
right.
going to move. Ready?
Okay, do I do it? Okay.
Nope, just come with me.
Okay.
1, 2, 3.
Okay.
Oh, I forgot to get something in my office.
Okay,
I'll be right
I just
back.
don't think I'm so. No.
Take a moment to discuss the previous scenario. What ethical dilemmas do you see? How could the situation have been handled differently to adhere to the Code of Ethics?
Hi, Mike. My name's Dr. Actrick, but you can call me Jerry. How are you today?
I'm doing well. How are you?
Good. Have you ever had occupational therapy before?
I actually have.
Oh, great. Okay, well, we're going to come over here and do an activity with some folding of some napkins, but first I got to transfer you over. Are you ready?
Yeah, sure.
Okay, all right. Well, I'm just on the count of 3. We're just going to go, okay?
All right.
Ready?
Oh,
1,
yep.
2, 3.
Okay.
There we go. Okay, so what I want
No? Okay. Hey,
How are you?
Hi, I'm doing good. How are you?
Good. I'm Dr. Actrick, but you can call me Jerry.
Nice to meet you.
Very nice meeting you. Have you ever been through occupational therapy before?
Yes, I have.
Okay, great. So what we're going to do today is we're just going to transfer you from your wheelchair over to the mat table, and we're going to do some activities with folding napkins and kind of work on some trunk stability, okay?
Okay.
All right, but first things first, I want to get you in your gait belt to make sure we're both nice and safe. You lift your arms up?
Yeah, sure.
All right. Put your arms down. Thank you. It's going to be kind of snug, but that's going to make you nice and safe. Okay. So we're going to do a stand pivot transfer, and I'll kind of walk you through as we're going, but can you scoot forward to the end of your chair there?
Sure.
Okay. All right, so you got your knees about hip width apart, feet are in a good position. So I'm going to grab a hold of you here, and I want you to put your arms right here to support, and you're going to help push yourself up.
Okay.
So on the count of 3, we're going to rock forward, and then I'm going to have you stand,
Okay.
and then we're going to take short little shimmy steps over to the table.
All right.
Okay, ready? You get nice and close here. Ready? On the count of 3. 1, 2, 3. Good. Okay, you can hang on to my arms. All right, well, do you feel the back of the table on your legs there?
Yeah, I do.
Okay. Go ahead and lower down. Perfect. Okay, are you feeling good?
Yeah, I felt great.
Okay, so what we're going to do...
Fold myself.
You did good. Doing a great job. Perfect. How are you feeling right now?
I'm doing good. That was good.
non-maleficence, which is the obligation of the OT to not impose risks of harm even if the potential risk is unintentional. First and foremost, transferring a patient without explaining to them the steps of the transfer and talking them through it while it is happening could create fear for all future transfers and harm the therapeutic relationship.
Wow, great observations, Mike. Also, leaving an unsteady patient alone on the mat table or not giving the patient your full attention can pose a risk of them falling and even a possible injury. We as therapists are only human. If you find yourself in a situation where you have forgotten a piece of equipment that you need for the session after transferring a patient, there are a few things that you could do to safely remediate the situation.
The best case scenario would be that you make sure to gather all of your equipment prior to transferring the patient and then give the patient your full attention throughout the session as demonstrated in video number 3. However, we know that this isn't always the case. If you were to forget some equipment, the safest way to handle the situation would be to...
Number 1, ask someone else to retrieve the equipment for you if you are in a setting where others are around. Number 2, ask someone to sit with your patient and stabilize them on the mat table while you go retrieve their equipment, again if you are in a setting where others are around. Or 3, transfer the patient back into their wheelchair and ensure that they are safe and secure before going to retrieve the equipment.
Now, watch another video and see if you can identify the ethical dilemmas in question.
How was your day?
Pretty good. Average Tuesday. Didn't see much though. Was something keeping you busy?
Yeah, my 1 o'clock patient really backtracking and not making the progress that he needs to, and it's like a waste of my time. He's on his 3rd stroke. Just, I can't.
Who was it?
Brock Lee.
Oh yeah.
So yeah, you know.
Take a moment to discuss the previous scenario. What ethical dilemmas did you see? How could have the situation been handled differently to adhere to the code of ethics?
So how was your day yesterday?
Good. Just your average Tuesday. Didn't really see much though. Were you busy with something?
Yes. Pterodactyl's just really been backtracking, and I just can't get her motivated. There's I don't even know why she's even seeing me. It's ridiculous. I'm getting really, really tired of it. Did you know that her sister had, so she has a history with strokes, but her sister just had a heart attack a couple weeks ago. Did you guys know that?
No. Wow.
Wow, that's so sad.
That's crazy.
Wow, Mike!
Son of a bee sting, those ladies can gossip. Take a moment to discuss the previous scene. What ethical dilemmas did you see? How could the situation have been handled differently to adhere to the code of ethics?
Pretty good. Average Tuesday. Didn't see much though. Was something keeping you busy?
Yeah, I was kind of busy with patients all day. Overall, all my patients are doing really well. I just have this one patient that's kind of lacking motivation, and he's going through a hard time. So it's understandable. I always have those moments.
Yeah.
But
Who's
yeah.
that unmotivated patient? Maybe we could brainstorm some ideas and get him motivated for therapy.
Well, Hippa, duh. I can tell you who he is, but yeah, maybe we can talk tomorrow and get some ideas and stuff of how to help him.
Thanks again, Hannah White. By Jove, I think they've got it.
You know, Mike, I think they do. The ethical dilemma demonstrated is autonomy and confidentiality, which is the OT's professional duty to treat according to the client's desires within the bounds of accepted standards of care and to protect the client's confidential information.
It would be unethical for an OT to discuss clients' personal information with anyone not on the client's treatment team.
They've done studies, 60% of the time, OTs get it right every time. But now that you've had this training, we're confident you'll get it right 100% of the time, every time.
Tune in next time to Radical Red News, where we will be interviewing an expert in the field, Professor Barrett Miller. Remember, we're here every Monday from 2 to 4:30.
You stay classy, OT 3840. I'm Mike.
And I'm Mike, and we'll see you next time.